this video, we will discuss how a 78-year-old man with diabetes and stage 3B kidney disease managed to continuously improve his kidney function for 7 consecutive years. Yes, 7 years of consistent improvement by doing something almost unheard of. Are you ready? Are we not trying hard enough with chronic kidney disease, CKD? In fact, he received a personalized treatment for his kidney disease. I know that sounds unbelievable in today's healthcare system. And there's more. His treatment also included a powerful vitamin that your doctor may have forgotten to mention, let alone prescribe. Yet, despite these tremendous breakthroughs, we continue to act as if CKD, a disease that drains the vitality of 1 in 7 adults in the United States, is an unsolvable puzzle. Newly diagnosed CKD patients today are still told that there's nothing we can do, everything will only get worse. And, unsurprisingly, when you do nothing, things do get worse. But the real question is CKD truly unbeatable, or are we just not trying hard enough? To answer this question, I want to present a case report published in a reputable medical journal. Let's talk about a 78-year-old man suffering from CKD and some of its most common complications. Yes, this man is not only battling CKD, he is also dealing with high blood pressure, diabetes, atrial fibrillation, high uric acid, anemia, high cholesterol, thyroid problems, metabolic acidosis, and mineral bone disorder. He has more medical conditions than most hospital departments, most of which are caused by CKD. And here's the harsh truth: if even one of these problems is left untreated, CKD will not improve. You can't pick and choose, you must treat the whole body, or you will fail. There is no improving CKD markers without diagnosing and treating each condition. Alright, and doctors know this very well. That's why they tell you there's nothing they can do. And yet, this man improved. He found a doctor who truly cared, a doctor who treated every problem he faced, not just 1 or 2. And the result? By the end of the study, he was 85 years old, and his kidney function had almost returned to normal. Let me say that again so there's no confusion: this man had stage 3B kidney disease in his 70s, but his kidney function improved over several years. So, no dialysis for him. Instead, his doctor gave him detox supplements, vitamins, and dietary recommendations. So, here's my point: there is no improvement in CKD without treating its complications. Doctors can't just prescribe blood pressure medication and then cross their fingers, hoping the kidneys will work fine. If you want your patient to overcome every obstacle, you need a complete, personalized battle plan. Now, we will look at everything you need to know about the treatment this patient was receiving in just a bit. But first, if today's story has you wondering why your doctor isn't treating your CKD this way, you're not alone. Because real improvement only happens when you receive the complete treatment you deserve. One of the first complications this man was being treated for was anemia. Now, 60% to 70% of CKD patients have anemia, and really, if you're feeling tired right now, it could be because of that. Anemia makes you feel tired because it's a condition where you don't have enough blood in your body. Yes, you heard that right. Not enough blood in your body. And while some doctors in the US may disagree with me on this, not having enough blood in your body is actually a serious disease. It can lead to a number of problems later on, such as feeling extremely tired, heart issues, dialysis, and even death. You might be thinking, well, of course, we should treat a life-threatening condition. Yet, many doctors still prefer the wait-and-see approach when it comes to anemia in CKD patients. In fact, some doctors have even openly said that because CKD causes anemia, there is no need to check iron levels in CKD patients. The old wait-and-see approach. And here's the sad part about that: even if it's true that most CKD patients do have anemia due to CKD, that doesn't rule out the possibility of another deficiency. Both can happen at the same time. Alright, and both causes of anemia need to be treated. Really, if you ask anyone who spends hours each day reviewing test reports for CKD patients, like me, for example, they will tell you without a doubt that many CKD patients also have low iron levels. So, if you're a doctor following me right now and you're thinking that maybe one or two of your patients could use a little iron after all, here's a pro tip: anemia from CKD is usually normocytic and normochromic. If MCV is low, microcytic, check for B9 or B12 deficiency. If it is high, macrocytic, don't just blame CKD, check iron levels. The wait-and-see approach won't help here, and your patient could be in urgent need of iron or vitamins. Now, very important, what should you do if you are a patient and you suspect that you are not being treated for anemia? Treatment for anemia is based on your test reports, of course, and on your symptoms and stage of CKD. Make sure you are being tested for hemoglobin, iron, and ferritin. Make sure you are receiving appropriate treatment. Talk to your doctor if you are unsure, because, and remember this, anemia is treatable, and getting treatment for it as soon as possible can make a big difference with CKD. Alright, let's get back to our 78-year-old kidney warrior. We've seen that fixing anemia is the first step to saving his kidneys, but that's not the only battle he has to fight. Because when you're at stage 3B CKD, your kidneys aren't just sleeping, they're throwing a party where every complication in the world is invited. And next on the guest list, metabolic acidosis. You know, because nothing says a good party like acid slowly melting you from the inside. Fortunately, this patient received something that could save his kidneys: sodium bicarbonate. So let's talk about the only kitchen cleaner that can actually help kidney health. Sodium bicarbonate works by treating metabolic acidosis, which, if you're lucky enough not to know, is when your blood turns into acid soup, defined as too much acid in the blood. If that doesn't sound bad enough, consider this as a buy one get three deal. In fact, metabolic acidosis not only damages your kidneys, it also raises your serum potassium levels. It can damage your bones and lead to muscle mass loss. Fun fact, some patients are still advised to eat more meat to keep their muscles healthy. Warning, all that meat only produces more acid, which then destroys the muscles they're trying to save in the first place. So science tells us that if you have CKD, eating more meat to keep your muscles healthy is like trying to put out a house fire by throwing more gasoline on it. But it's keto-approved gasoline, so it's fine. You can actually improve your muscle mass by fixing metabolic acidosis, according to a recent meta-analysis. So the next time your cousin Bob, who gets all his health information from fitness memes, tells you to eat some meat, show him this study and watch him pretend to understand what it says. Anyway, for those who don't mind losing a bit of muscle, remember that muscle mass is directly related to not dying early. So maybe it's time to care, just a thought. That's why I've been so adamant about telling you to ditch beef and hit the weights at the gym instead. How can you effectively treat metabolic acidosis? Well, by following the guidelines on my board, of course. The first step here is to ensure you're being tested because, obviously, just drinking sodium bicarbonate like you're an unplugged sink isn't going to help. Instead, do it like this: what value should you be tested for? Make sure it never falls below this number. Now, this test should be done regularly, even in stage 3 CKD patients. But what if this number is too low? Well, that's when you need sodium bicarbonate. Here are all the dosages and everything you need to know about sodium bicarbonate. And there's a reason why we do these precise calculations before giving a patient sodium bicarbonate. While this supplement is quite safe, it still contains sodium, which isn't great for your blood pressure at high doses, and it can still cause discomfort. So consult your doctor and make sure they're addressing this properly. And don't forget, fixing acidosis isn't just about taking sodium bicarbonate. Cutting back on protein and replacing it with fruits and vegetables also works wonders without any side effects. Improving your diet might even help you regain a bit of muscle. Not bad for something that doesn't need a prescription. We've just covered two of the most important complications of CKD, anemia and metabolic acidosis. But we're not done, because if our 78-year-old patient wants to truly reverse CKD, a few more issues need to be addressed. Next is vitamin D deficiency. Let's talk about vitamin D deficiency. I want to focus on this issue in particular because it's still underestimated by many doctors today. But let's give credit where it's due, things are slowly improving. I'm finally starting to see more patients coming in with their vitamin D levels actually being tested, rather than just guessing based on how many bones they've broken tripping over a Roomba. And really, without proper vitamin D, your bones can break faster than your willpower at a donut shop. Vitamin D deficiency is so common in CKD patients that you should get it checked right now, even if you're still healthy enough to jump out of a chair without groaning like a 90-year-old. And vitamin D isn't just about bones, it also affects your immune system, cardiovascular health, and yes, your kidney health too. So if you haven't checked your levels recently, add it to your to-do list. Now, while vitamin D is important, there's an even subtler problem our patient faces. Let's talk about homocysteine. Don't worry if it sounds like a spell from Harry Potter, it's actually much more interesting. So what is homocysteine, and why should you care about it? Homocysteine is a normal amino acid, nothing special. Everyone has it, and it's fine until it starts to build up. And when it builds up, congratulations. You've just earned a higher risk of coronary artery disease, heart attacks, blood clots, and of course, kidney damage. And if you think this doesn't apply to you, think again. As we can see in a recent study, this issue is extremely common in CKD patients. 8 out of 10 patients observed had excessively high homocysteine levels. 8 out of 10. But why does that happen? Because your kidneys have to help eliminate it. And if they're on strike, guess what you get? Warning, it's not a free trip to Disneyland. Now you might ask, how do we fix this homocysteine situation? And the answer is with a 3-in-1 bounty hunter dose of vitamins, folic acid, vitamin B12, and vitamin B6. They literally take homocysteine out of orbit. But you might be thinking, but I get those vitamins from my multivitamin. Bless your little vitamins, they're trying their best. But they're not effective here. You're right, your daily multivitamin isn't enough to put out the homocysteine fire. No, you need therapeutic doses. You'll see a big gap between the usual vitamin doses and the actual doses needed to fix high homocysteine levels. Not the same, right? And while taking these doses of the 3 vitamins is safe, I still wouldn't recommend doing this without your doctor's supervision. Why? Because not everyone responds the same way to this vitamin therapy, and some patients will need other interventions. There are other interventions that can help with homocysteine. Betaine TMG, a supplement often sold for liver support, can play a big role in clearing out this amino acid. But you might already be using it for your kidneys, right? And another thing you should also do is follow a low-protein, plant-based diet. What does diet have to do with homocysteine, you ask? You see, homocysteine is a byproduct of an amino acid called methionine. So cutting down on protein automatically reduces the building blocks for this toxin, along with hundreds of other toxins you'll cut down when you reduce protein intake. And that's all for today. Thank you for watching. I wish you all the best. Goodbye.